Welcome back to Retired with a Full Heart at Home. I'm so excited because I got a CT scan and it was so easy and quick that I thought I would tell you guys about it in hopes that you might be motivated to go and get one. It's kind of cool. 10 minutes in and out, super easy and fun. Tell all your friends. That's what they say. So that's what I'm doing. I'm telling all my friends, go get your heart scanned. What is a cardiac CT scan? So it's a multi-slice X-ray that looks through your heart, looking for calcifications in plaques in your arteries. So I was a perfect candidate for a CT scan because of my age. I'm 59, and cardiovascular disease is a progressive age-related disease, so I'm a good age to have that. And because my atherosclerotic risk factors were unclear. So some of them pointed in the direction of higher risk and some of them pointed in the direction of lower risk. As an example, in the table, I have a elevated non-HDL cholesterol. So my LDL cholesterol is higher than recommended. It's 136 and they recommend less than 100. My apolipoprotein B, which is a type of lipoprotein that carries LDL cholesterol and triglycerides in a package. It's coated with a protein on it that lets them very accurately count how much LDL cholesterol you have. And my Apo-B is elevated. It's at 93 and it's supposed to be between 40 and 70. And also I have an elevated level of lipoprotein A. My level is 69 and it's recommended to be less than 50. This is the inherited type of cholesterol that can't reduce the level of with lifestyle factors. I have cardiovascular disease in my family. If you remember, Bob Harper infamously had a heart attack in the gym. I believe his heart attack was attributed to a high lipoprotein A. My HDL, though, is actually pretty good. It's 84 and it's recommended to be greater than 60. So I have the particles swimming through my blood that are undesirable and can cause cardiovascular disease and atherosclerosis. But on the good side of it, I have low risk factors when it comes to endothelial or the lining of the blood vessels being damaged and weakened and susceptible to gathering these particles. I have low C-reactive protein. I do have a slightly elevated homocysteine, but I have low blood pressure and low blood sugar. So those indicate maybe the LDL particles won't stick to my blood vessels. That's what the CT scan is intended to tell me. Here's the fun part. So the CT scan, I did not have to so much as take off my sneakers. So I showed up in basically what I'm wearing, this t-shirt, and jeans and sneakers, and you just lay down on the table. You don't have to disrobe. And I know us ladies out there are just plain sick and tired of having to take our clothes off every time we go to the doctors. It just drives you crazy. So that was really fun, surprise. So you just lay down on the table and they hooked up a probe here, a probe here. So wearing a loose fitting t-shirt is a good idea. And then they just lifted my t-shirt to, let's see if I can, to put a probe like here and here. So it was no big deal. And then they slide you into the machine and it spins and takes these multi-directional x-rays. I think at one point you hold your breath and then you release and breathe, and I think you go in and out a couple of times. And I was in and out, in no kidding, like 10 minutes. So how cool is that? Luckily, my calcium score was 0. Woohoo! I had those results by the end of the day. I think my scan was around 1 o'clock, and I think we had the preliminary results before we got home. So that was really cool. And I included on this slide the scoring system. It's from 0 all the way up, and 0 is no identifiable calcium deposits, and then it goes on up from there. So, woo! I don't want to be a Debbie Downer, but the CT scans are like a first level. They only can see hardened, white looking spaces where there's been calcification, where plaques have actually calcified. They can't detect soft plaque. Soft plaques are actually dangerous. If you want a good reference, read Peter Attia's book. He has a really great treatment of the atherosclerotic process in there, and he describes how that works. I'm going to just quickly try to summarize what I think I read, but you should read for yourself. When LDL cholesterol gets stuck to the endothelial and oxidizes, that's when trouble starts. So the immune system sends out cells called monocytes to enter the subendothelial space, and then they transform into these macrophages, which are larger, hungrier immune cells. And this is the good news, right? This is what happens if you get LDL cholesterol stuck, and your body is really amazing, tries to correct it. So it sends out these monocytes to try and eat up this LDL cholesterol, and it swallows up as much as it can, tries to remove it from the artery wall. But if in the process of doing that, it consumes too much cholesterol, then it blows up into this thing called a foam cell, and you get a fatty streak in your arterial wall. HDL cholesterol, which is the good cholesterol, can actually suck that cholesterol back out of the macrophages in a process called delipidation and slip it past the endothelial layer and back into the bloodstream, and it can transport the excess cholesterol back to the liver. Isn't that amazing? So I'm sure I didn't get all of that right, but effectively that's what happens when LDL cholesterol gets stuck to the lining of your blood vessels, and how the body reacts to that to try and clean it up. Here's the bad news. The bad news is that what it can't clean up either has to be stabilized and gets calcified, or it can erode and rupture, ultimately form a clot, which can narrow your blood vessel and impede blood flow, or it can, even worse, break free and cause a heart attack or a stroke. Actually, calcified, oxidized LDL cholesterol is actually better than soft plaques, which can still break free and do damage. If you've had calcifications, then a person most certainly has plaques that are soft plaques and have not yet been stabilized. So that's bad news. A 0 CT scan doesn't really tell you anything about the soft plaques that can still cause a heart attack or a stroke. So if I want to know if I have soft plaques, then I will need something called a CT angiogram. I am thinking about doing a CT angiogram. So if any of you out there have actually done one, I'd appreciate any insights you have into how that worked. I believe that test has contrast, so there's a bit more risk associated with it, but I'm not sure, and you really need to do the research. But in the meantime, I'm just going to keep trying to lower my saturated fat and get my LDL cholesterol down as indicated by Apo-B. And I'd like to target 50 milligrams per deciliter. That's really aggressive, and I'm really not sure that the dietary changes that I've made so far are going to get me there, but we'll see. I'm going to retest in about 3 months. It just stands to reason that the more lipoprotein particles you have in circulation, the more likely they are to get stuck in the endothelium. If in 3 months, when I get my lipids retested, if I haven't been able to move the needle much, I'm personally not opposed to taking statins or other lipid-lowering medications if diet doesn't work. We'll see. So I'd really like to take cardiovascular disease off the table. There's plenty of other things to worry about. Anyways, I'm curious what you guys think about CT angiograms, statins. Have any of you been able to lower your LDL cholesterol or ApoB targeting like 50, and what did your diet look like? Thank you for watching the video. I hope you stay well. I hope you stay free of cardiovascular disease and atherosclerosis. I hope I'll see you in the next video.